So, hello and welcome to one more session on defining your medical career. Hi, friends, I am Dr. Bankim Jani, and last Wednesday also we met and we talked about national exit exam, that is the NExT. Today we'll be talking about USMLE. Now, see, the whole idea behind it is I'll introduce myself in a short while, but why we are over here. The whole idea behind this is that, say, once you get your medical admission, that is, once you plan that yes, you want to become MBBS, right? The roadmap should be crystal clear that what exactly you'll be doing, what are the exams which will be coming up, right? So that you can prepare well. That's the whole idea, right? So that you can prepare well. Due to this purpose, so that your knowledge is absolutely updated about the future steps along with VMAP, right? VMAP is Vishwa Medical Admission Point. I, along with VMAP, right? I am Dr. Bankim Jani. So we have planned these sessions. The whole idea is to give you the updated knowledge about how do you prepare well right from the beginning. These exams, they are like competitive exams, right? So you have to prepare very well, and you can prepare well only when you know that what steps are to be followed or what exactly is coming up, right? So what's coming up. So once your path is clear, it is easy to run. But that's the whole idea behind all these sessions. Right? I did my MBBS, then MD Radiology, DMRE, and more than 25 years of teaching experience, right? Thousands of students they have learned. Plus, I am into IT also. So, more than 7,500 students in IT, right? I got 23 international degrees in Cisco, Sun Microsystems, Novell, and Microsoft. Plus, I am a marathon runner. I am into painting. So you can watch my paintings on my YouTube channel also. But the best of all is I love teaching, right? So that's why even last year also, in association with Vishwa, say we conducted multiple sessions for actually first MBBS students, that is those who have taken the admission, and then how to make their path easy, right? Okay, so let's start with our today's topic. Last Wednesday we talked about national exit test, NExT, right? That was the topic which we discussed last time. This time we are going one step higher. Now see, when we talked about national exit test, you must have noticed that it requires very precise planning. Right? Day one, day two, day three, right? The exams they were getting conducted. But the whole game is of 3 days, right? After 3 days, you have given all those exams, you clear it, and then that score was sufficient for your PG admission, right? And in case if anyone is not interested in doing PG, then at least he has got the right to practice. That's next step one. You do the internship, and then this is step two. But step two, which is clinical, and in clinical, though it is just pass and fail, right? Score is given over here. This is in nutshell. This is in basics, right? But when we talk about USMLE, it's a completely different ball game. Completely different, right? It's not like a simple exam. It requires planning. Why do you need it, right? All the answers right from the understanding of all the steps to how to apply, how to check whether your college has got that FAMER number, right? I'll show you all of these practically with with the with the site that where exactly you have to see. I'll give you the URLs also. We'll actually check also. So USMLE is United States Medical Licensing Examination. I will stress on this word licensing, right? Licensing examination, because it is this exam, when you clear, you get the license to practice in US or Canada, right? But it's not so that you get the license to practice only in US and Canada, right? There are so many other countries also. But let's start with this, right? This is basic, then we'll be adding more and more to that. For whom it is? It is for, in simple words, it is for IMG. IMG stands for International Medical Graduates, right? International Medical Graduates. Now this is with perspective of US, right? So is this exam necessary for those who are doing MBBS from US or Canada? No. This is for international medical graduates, or this is important for you, medical students. That means you have not yet cleared, your MBBS, but can you appear for USMLE? Yes, you can, right? This is for rest of the world. It is not for US or Canadian students. It is for rest of the world, right? It is for rest of the world. So whether you have passed MBBS from India, or you have passed MBBS from Georgia, or you have passed from anywhere in the world except USA and Canada, right? Except US and Canada, this is the exam for you, right? When can you appear in this exam? Well, you can the moment you take admission into medical college, you can. But step 1 exam, I would suggest you appear after your second year of MBBS, after second year. Now you'll get the answer that why I am telling this, right? So this indicates that there are steps, step 1, step 2, step 3, right? So let's see those steps. So USMLE, United States Medical Licensing Examination, is divided into 3 parts. One, what is called as the step 1, first step. Second, it is called as the step 2, obviously. But step 2 was having 2 things previously. It was called as the CK and CL. CK and CL. CK stands for clinical knowledge. Clinical knowledge, right? Clinical knowledge. And then CL stands for CS stands for clinical skills. Now this step has been removed. Actually, it's not removed. There is step 3. So this step has actually been merged into step 3, right? So for our purpose, let's start with step 1, right? That what exactly it is in step 1. Here it is. The step 1, the first step, what would be asked in that? First year subjects, anatomy, physiology, biochemistry, right? Biochemistry. These are the core subjects of first MBBS, right? So this is pretty clean, but plus there are something extra. It is what is called as the behavioral science, right? Behavioral science. Then communication skills. Now see how important this is. Communication skills. Many times students, they ask us that is it necessary to develop say communication skills, especially in English? Yes, it is indeed, because see, right from the step one, right from the beginning, this is something what is asked. Plus there would be questions from pharmacology, and most important, which you should not miss, is the pathology. And the weightage of pathology is almost 40%. That's the reason I was telling you that you need to appear, if you wish to appear for step 1, do it after second year MBBS, because in second year MBBS you will be learning pathology and pharmacology. Obviously anatomy, physiology, biochemistry you learn in first year, right? But this behavioral science and the communication skills, that is something which requires time, and you need to focus properly on that. So this is something which requires about 2 years for the preparation, right? But see, the clarity is you need not wait till completion of your MBBS and then start appearing for step 1. No, you can do these things parallelly. Those, you are competing not with the national students. Now this is the international competition, right? This is your international competition. This is the reason that you need to plan very properly in advance. Okay? Now let's see how the exam is, because unless and until you don't know the exam pattern, it is difficult to prepare for it, right? So here it is. It's a day 1, in fact only 1 day exam, right? So let's make it a 1 day exam, right? This one would be better. So this is a 1 day exam, can appear after second MBBS, right? For your sake and for your convenience, right? We are talking about step 1 USMLE. Now here the whole exam is divided into blocks, right? Understand the concept. It is called as the blocks. Blocks means you focus for 60 minutes. 60 minutes, right? In these 60 minutes, you will be asked 40 questions. 40 questions will be asked. Yes, they will be MCQs, right? MCQs. Not necessarily one liner, right? I said MCQs. So they might give you a lengthy description and then you have to select the correct answer. Okay. So 40 questions in one block, right? And this block is of 60 minutes. Such 7 blocks. So multiply by 7 blocks. So there would be such 7 blocks. 7 blocks means 7 hours. Yes, you got it right. There are 7 hours, but the exam is of 8 hours, right? Plus 1 hour. And this 1 hour is break, right? So in case if you want to take any break, so then that break can be taken in between the blocks. Once the block starts, right? Once the block starts, you can't take a break in between. Okay. So I'll explain it still properly. Say your exam starts at 10 o'clock. First block is from 10 to 11. In this 10 to 11, you'll be asked 40 questions. 40 questions. You answer those questions. After that, you want to take a break. Fine, you take a break of, let's say, 15 minutes, right? 15 minutes. So now your next block would start at 11:15, but once this block starts, it will continue till 12:15. After that, you don't want to take any break, so no problem, continue. Then it will go till 1:15. So here 40 questions, here 40 questions. After that, you feel hungry. You want that, yes, I want a 30 minutes nice lunch break. So yes, you take it. 15 minutes you have taken over here, 30 minutes you take it over here, right? So that way, total 1 hour of break is permitted. Am I clear? So such 7 blocks will be there. That is, you'll be appearing for the exam for 7 hours. So total, it is like in every block 40 questions. So total 7 4 is 28. So this is 280 questions exam, right? Simple as that. 280 questions exam. One interesting thing is that let's say in any of the block, right? This block is of 60 minutes, but let's say you completed, you are sharp enough and you completed all those 40 questions in, let's say, 40 minutes, right? 40 minutes. So then you have got that extra 20 minutes with you, right? Well, you can take a break, right? You can enjoy. That's your time. So you can take a break, and this time won't be counted into that 1 hour break, right? This is extra because you finished earlier. Clear? Right. So this is the pattern for day 1, right? Step 1, right? Which is a 1-day exam. Now, as I said, that for the step 2, which will be appearing at a later stage, right? This step 2 is called as the CK, clinical knowledge, right? And in clinical knowledge, you will be asked all systems. You'll be asked about all systems, right? And this would be related to diagnosis. So you'll be going for the diagnosis plus initial treatment, right? Initial treatment. That is the basic treatment. But very important, what is will be asked is, that is the legal and the ethics. That is how you should behave with patient, right? Ethical issues. You'll be asked about the patient safety. Now, these are the things which are bit new, especially when we are appearing these exams, right? And when we study our normal subjects, these are the extra this is the extra emphasis which is given to the patient. And because this is United States examination, they care for their patients from this perspective also. So there are several rules like HIPAA rules, etc., which you need to know in these legal and ethics, plus the patient safety, right? So the whole idea is your clinical knowledge will be tested, right? CK stands for clinical knowledge. Everything would be asked, all systems, right? So this is the exam which you would like to appear once you have finished your clinics. So somewhere in the 4th year or 5th year, right? So that one would be fine. Again, this is a 1-day exam, right? This is a 1-day exam. But this time, this exam is of 9 hours. Now you know that when it is of 9 hours, so that means there would be 1 hour break, right? That break is included into those 9 hours. So we have got 8 hours of active exam. So how this is split? So 8 hours exam, right? Again, 60 minutes block, right? 60 minutes block. So in between the blocks, you can take a break, right? But the total break between all the exams, that should not exceed 60 minutes, because maximum 1 hour is allowed. Over here, 40 questions per block, right? Almost the same style. So total, ideally it should be 320, but in 2 of the blocks, it is like 39 questions, right? So the total will be 318 questions exam. This is the thing. Again, MCQ, right? But not a single liner. So this is the idea. Quite similar to first step 1, right? On to the step 3. Now, step 3 is a beauty, right? But the thing is, this you have to give in USA, right? So it is in USA only. Step 1 and step 2, there are specific centers which are called as the Sylvan Prometric Test Centers. There you can register for the exam, right? And I'll show you all the steps, because it is not so that straight away you go over there, you register, and then you can appear for the exam. No, no, no. There are some very, very specific steps, the preparation of which it can be done even from today, right? So chalo, let's see this. Step 3. So step 3 is that which will be appearing in US once you have cleared step 1 and step 2. What's the purpose of this step 3? Right? It is, they say it like this, that it is the readiness. Are you ready for unsupported, right? Unsupported. That means there is no one over there to help you. Unsupported practice. Are you strong enough or powerful enough to go for this unsupported practice? This is the whole idea, right? And in order to test this exam is divided into 2 parts, and it is day 1 and day 2. This is a 2-day exam, right? So they have given a name to that. This is called as the foundation, right? This is the first day of step 3. So it is foundation of independent practice. This is the meaning. Foundation of independent practice. That's the whole concept. So over here, there would be 6 blocks, right? Say everywhere it would be, exam would be in the form of blocks. So 6 blocks, right? Every block 60 minutes, right? 60 minutes block. And in every block, there would be 38 to 40, right? 38 to 40 questions, right? So total over here, that would be 232 questions total. That's your step 3, day 1, right? Crystal clear, right? And obviously MCQs. Now this day 2. Day 2 is interesting. It is what is also called as the advanced medical, clinical medical, right? Advanced, I should write like advanced clinical medicine. So the clinical word is over here. Now people find this exam bit tricky. The reason is again divided into 2 parts. One part, say over there, this is day 2, right? This is day 2. Day 2. In this, there would be questions again in the form of blocks, right? But these blocks, this time, they are 45 minutes block. 45 minutes block. 30 questions per block, right? So the questions they have decreased, right? 30 questions block. Such 6 blocks, right? So 6 blocks. 6 blocks, 30 questions, so that comes to 180 questions, right? So 180 questions, 180 MCQ questions. Now these questions, they will be bit different. They'll be like when you have to do some diagnosis, right? They will be like a diagnostic questions. So don't say underestimate it. Diagnostic questions. But then there comes the second part of it. This is day 2. The second part is where you'll be asked for the 13 cases. 13 cases. There'll be 13 cases, right? About 10 to 20 minutes will be given per case, right? Per case. So that's how, say, you will be evaluated, right? And all these cases, right? All these cases, they are like computer-based case scenarios, right? They are computer-based case scenarios. And that's where your diagnostic skills, they will be really tested. Fair enough, right? So now you know that what is there in USMLE. We have got day 1, day 2 in step 3, right? And total step 1, step 2, step 3. So in nutshell, step, right? These are the steps. Step 1, ideally after, right? After second year, obviously second year of MBBS. Then step 2, say after your 4th year, right? But when you have got this thing in mind that yes, I want to appear for this test, you'll be preparing accordingly, right? And step 3, obviously it is in US, right? No doubt. Great. Now, once you clear your USMLE, where is it valid? Obviously, you'll be able to do practice in USA and Canada, right? That's fine. But there are some other countries also where this USMLE is valid. One, India. So yes, if you have cleared USMLE, you don't have to appear for national exit exam. Next, you pass your NExT, you are eligible for say medical practice in India. But if you clear USMLE, then also you are allowed to practice in India. Not only in India, Australia, right? So the gates, they open in so many countries once you clear your USMLE. So Australia, UK, that's right, UK, right? United Arab Emirates, then say Dubai, right, which is now called as the DHC, Dubai Healthcare City, right? I'll just write Dubai. Dubai, you can do practice over there, right? Or Israel, Ireland, right? Israel, Ireland, then New Zealand, all these countries, right? They allow you to do practice. Qatar, right? This is the list. Over here, I've written UK. That's right. For UK, right, there is one more test which is called as the PLAB, right? Yes, you can appear for PLAB, but once you clear the PLAB, you can practice in UK, but not in any of the other countries, right? Today, our focus is USMLE, but yes, to go to UK, there are some other paths also. PLAB is one of the path, but USMLE is big boss of all of them. So now let's start with what are the steps, how to apply, right? How to apply. To apply for this test, understand the word ECFMG. ECFMG, right? ECFMG is Education Commission of Foreign Medical Graduate, right? It is Education Commission of Foreign Medical Graduate. This means this particular step is not needed for those who are in US or Canada, those who are appearing from US or Canada. Because for USA, if someone is passing from USA or Canada, they have got what's called as the NBME, right? This is the National Board of Medical Examinations. So that is separate. So we'll not be touching on that. That is those who have passed from US or Canada. For rest of the world, right, this is ECFMG, right? This is for rest of the world, right? Rest of the world. So obviously we shall be focusing on that. Now in that ECFMG, you have to register, you have to apply for what's called as the Form 186, right? Do remember, this is Form 186. Why is it? This is nothing but it is your identification. Right? This is what is called as the certificate of identification. Certificate of identification. And that's permanent. This is permanent. Once you have acquired it, this particular number will remain with whole of your life, right? It is to be done only once, and it can be done the moment you take the admission, right? So ecfmg.org, that's the site. That's where you have to fill this form, right? You have to apply. One important step is that though you will be applying online, but you have to take a printout and you have to notarize it. So you take that form 186, fill it, and you have to notarize. Last time when we conducted this session, someone asked that what is notarization? Notarization means you have to take this thing to lawyer and he will check all the details whatsoever you have filled up, and it will confirm that everything filled by you is authentic, is properly checked. And then you submit. Right? It will take about 2 to 3 weeks, and within 2 to 3 weeks you will get a number, right? You will get a number. That's your ID number, and this is permanent. Fine. So ECFMG, where you have to just put the basic details, right? And you will be issued this ID number. This thing is, I'll write the cost also. It will cost you $160, but this is compulsory, and it is once in life, right? Once in life. Is there any age limit? No. There is no age limit. Simply in capitals, there is no age limit. But now listen carefully. You should be officially, right? Officially enrolled. Either enrolled or graduated, right? These two words, they tell you the entire story. From a medical college, right? From a medical college. But this college should be present into what's called as WDOMS. WDOMS. It means when we say enrolled, that means when you are not cleared yet your full MBBS, so you are student, so that means enrollment. Or you have completed your MBBS and now you want to appear for USMLE, no worries. But only condition is that you have to appear from medical college which is appearing into the list of World Directory of Medical Schools, right? This WDOMS is World Directory of Medical Schools, right? Medical schools. We'll just check it out, right? This is wdoms.org. wdoms.org. Over there, you will search for your college, and then you will get what's called as the FAMER number. This is the number which you have to apply, which you have to say fill up when you'll be submitting for your number, right, to ECFMG. So this is the FAMER school ID, because this ID tells, or this ID confirms that yes, you are officially enrolled or you have graduated from a medical college. This FAMER number will be different for every medical college. Let's see how to see that, right? So whenever you take admission, right? Whenever you take admission, do check this thing. Otherwise, it happens like sometimes you have taken admission, and if that school is not appearing into this list, was problem, right? So wait, let me show you. Here it is. Say this is WDOMS, right? Word Directory of Medical School, right? So here it is, search the word directory, right? Here it is. Let's say I want to search for my college, right? So this is, say, India, right? Here it is, say India, and let's say city Ahmedabad, and operational. See, this is very interesting. Whether that college is still existing or not, right? It happens like, let's say after 10 years you feel like, yeah, I want to go for USMLE, but for certain reason, for anything, say unavoidable circumstances, that particular college is no more operational. Doesn't matter if it is getting listed over here. If you can see it over here, you can appear for the exam. So here is, I just go for search, right? Here it is, see, BJ Medical College Ahmedabad, and yeah, all the details. This is government medical college. Yeah. This college started in 1946, currently operational, Gujarat University, right, in English. All the details, contact information, program details, right, sponsor notes, every piece of information about BJ Medical College Ahmedabad, this is over here. But what I'm interested in is this FAMER number. See, over here, over here. This is the FAMER number, right? 1216, that's the FAMER number of BJ Medical College. Always check your college before taking admission over here. Now see, you can do it even it like this. Say Georgia, right? So here it is, Georgia, and city. Let's say we just don't put any city, right? Just want to see, is operational? Yes. You just click on search. Now here is the complete list, right? Kutaisi, Tbilisi, Batumi, right? All the cities over here, and all these colleges, right? Let's say we want to go for this David Twidliani. So yes, it is over there, David Twidliani Medical University, right? It is over there. It is in Tbilisi. So, and when you click on this, say here is the FAMER number, right? 1012. This is the FAMER number, and this is the number which you have to mention when you go for your ECFMG, right? So do check very properly, right? This is important. This is important. I say don't trust anyone. Just check your medical university whether it is appearing into WDOMS or not, right? After that, there is no point in blaming anyone, but this FAMER number is very important, right? Because this FAMER number, Foundation for Announcement of International Medical Education and Research, that's the FAMER, FAIMER, right? Because that indicates, that tells that yes, this particular institute is into medical education and research. Got it? Okay. Let's remove this. Okay. So that was WDOMS. Now comes you have now your ECFMG number with you, right? And as such, it is permanent. So even if you take it into first MBBS, that's fine, no harm, because in any case, it will remain with you for whole of your life, right? It is the same number. On to step 1. By the way, for any of the personal counseling, there is a WhatsApp number over here, right? This particular number. So you can always say send a message or talk about USMLE on that number for the personal counseling. Moving back to step 1, right? How to schedule your exam. Scheduling exams. Now this step is vital not only for you but also for your parents, because this is where the money is involved, right? Reasonably good money is involved. On the first glimpse, you might feel like, "Arey, these exams are so expensive. Itna kharcha, itni महंगी exam." Well, it is. It is. Say, I tell you that even in IT, right, there is one exam. This is CCIE, Cisco Certified Internet Networking Expert, right? That exam, right? It costs lakhs, right? Just one day exam and it costing in lakh, 1 lakh. Yes, it is. It is. But once you clear it, the value of it is so high that whatever you have spent, it becomes like a peanut. You earn that much. Same thing is true, because see, these exams, these exam fees, you'll feel like that they are pretty high, right? Exam fees. That's why I said parents needs to watch this, right? Tomorrow morning there is one session which is especially for parents, right? It is definitely students are also invited, but it is especially for parents because they need to know that these are the exams where they will be requiring some reasonable amount of money which they need to plan properly, because the exam fees over here is $985, right? $985 plus, right? Still it's not yet over. Plus there is a surcharge, right? There is a surcharge. Now this surcharge is simply because we are international students, right? We are appearing for this exam outside the US or Canada. So this is what is called as the international test, right? Because you'll be appearing for this test outside US. So international test delivery surcharge, this is what they say, and that is extra $185. Got it? So total would be, say, 1170. Now currently the rate which is going on is 82, 83 rupees of dollar, right? So if you multiply it by 82 or 83, so approximately it comes to about, say, 96 to 97,000 rupees, right? 96 to 97,000 rupees. This is for step 1. That's for scheduling exam. That is, you set the time that yes, I want to appear for this exam on this date at the Sylvan Prometric Test Centers. In case you want to change the date, that is rescheduling, right? Don't do it, right? When you are properly prepared, go for exam, because this rescheduling will cost you extra $604. This is the rescheduling fees, right? This is extra. Now this is eligible for 3 months, right? 3 months eligibility is there. Eligibility. So within 3 months, right? Again, understand this point. Let's say, right, for the ease, this is 1st January. You decide that you want to appear for the step 1, and something happens and you feel like, no, 1st January is too early. I want to appear for not in Jan, not in Feb. I want to appear in March, right? Let's say 15th March. Okay, no problem. You pay the rescheduling amount and appear. But then if you feel like, no, I'm not prepared even for the March, I want to appear in May. I want to appear in May. Well, you planned your exam on 1st of January. 3 month eligibility was given to you, that within 3 months, right, you appear. You are trying to extend the exam, reschedule the exam beyond 3 months, so then you have to pay extension of eligibility fees, right? Because this is what is needed. So it is called as extension of eligibility. Extension for eligibility. Eligibility is for 3 months only. You want to extend it for 3 more months. That would cost you $100, and it can be done only once. Only once. So if someone has planned the exam and then he or she is not appearing for 3 months, then he or she has to extend the eligibility for 3 more months by paying $100. In that also, if he or she is not appearing, then money is gone. Then one cannot appear. Then the whole process starts again. Okay. So simply golden rule is book the exam when you have prepared, right? When you have studied properly, you have prepared properly, you are now almost ready, book the exam, right? Why to waste rest of the money unnecessary for that rescheduling, etc., right? No. Now there is one interesting thing. How many attempts are allowed? Attempts, right? And remember, every attempt is costing you money, right? That $1,170. Every attempt is costing money. Now, before July, now see, these rules, they keep on changing. Huh? So I'm telling you the current rule. Before July 2021, 6 attempts they were permitted. Right? But now after that, at present, right? At present, 4 attempts. 4 attempts allowed. So that's the reason, apply only when you are ready. Now there is one interesting rule which is to be understood in this 4 attempts. Right? You can't take 4 attempts randomly. 3 attempts, right? 3 attempts allowed in 12 months. 3 attempts, right? So again, same example, 1st January, someone appears for the exam, right? In case he fumbles, right? He feels like, chalo, now I'll be appearing for this in 1st June, right? Something goes wrong even in this, right? He feels like I'll be appearing again. No problem. Chalo, he appears on 1st December, right? Again, result is not positive. But 12 months have passed, right? Next 1st January has arrived. Let's say this is 2022 and 2023 has arrived, right? Now he cannot appear. Though 4 attempts are permitted, but that 4th attempt he can plan only after 1 year. After there would be at least a gap of 12 months. So that means he can appear for that in 1st January 2024. 3 attempts they are allowed in 12 months, but then there would be a gap of full 12 months before someone goes for 4th attempt, right? Let's say if pass, right? Someone clears it, but then he or she feels like, no, I want to go for one more shot, right? Let's try for once more to get better marks. Not allowed. If pass, to then proceed further. Retake, not allowed. and results are pretty fast. Result you get it in 2 weeks, right? Result is in 2 to sometimes say 3 weeks. So that result arrives. Right? What about the score? I'm going into all small details so that you know crisp clean that what exactly is USMLE. The score is, result is in 2 to 3 weeks. Score will be displayed, right? It will be displayed on its website, right? Its website. URL would be sent to you and you can watch it on your website. Till when? For 1 year, right? For 1 year it is displayed over there. But when you want to apply, you need to go for what's called as the transcript. Transcript is what? Transcript is that in which everything is mentioned about your exam, your score, on which date you appeared, what was your score, whether you succeeded all the way or there were some attempts. Everything is mentioned into the transcript. This transcript, dost, it is called as the form. Once again, the form, right? The difference, understand. Form 172 and it is also called form 173. What's the difference? The difference is this is individual requirement, right? Individual requirement. What is individual requirement? It's like we want to appear for say our further studies, right? You want to go to US and you want to study, so you have to attach the transcript that this is my score in USMLE. That is your individual request, because they won't fax you or they won't email you, right? Nothing, right? No telephones, nothing. They will not give you the result on phone. You have to go for this transcript. This is form 172, individual request. Or some institute is directly asking for you that is this gentleman, has he cleared USMLE? Then we want to get his or her transcript. So this is what is called as the institutional request. Whosoever is requesting, they have to pay $70 for the transcript, right? $70 for the transcript. So that's how you clear your USMLE. Now, in case if someone has not cleared it, right? If someone has not cleared it and he or she feels that chalo, let's go for score recheck, right? I did so well, I worked so hard, but result is not good. Okay, result has arrived, it is not in favor. So within 90 days, you have to appear for, you have to submit what's called as the form 265, right? And again, it would cost $80. This is $80, right? And my advice is never go for it, because they have mentioned it very clearly that no manual checking would be done. No manual checking. No, it would be computerized, automatic, right? And then in case if there is any error, so then we'll let you know. Gentlemen, till date, that result has never changed, right? So my advice is don't waste this money ever, right? Proceed further, start preparing properly. So important, because they don't change the results, though there is a facility, but no, results are not changed, right? They remain same. So step 1 and step 2, both these exams, right? Both these exams, they will be costing same. There are same charges, same pattern, right? So $1170 and 70, right? So that's for step 1 and step 2. There is one more charge which is associated, and it is called as the verification charge. Now, who will verify it, right? Who will verify? Verification is done by the state. Let's say you have applied in let's say Houston, right? In some of the college of say Texas, Houston, right? Into the state of Texas. So in Houston, they will be that particular say hospital or college, right? This is the state medical licensing authority. They will verify whether the documents which you have submitted for this USMLE are right or not, and it would cost you $66, right? So that's how this whole scenario it goes. When you reach to US, right, after 2 steps, this is step 3, right? In USA, right? In USA. In 2022, the rates they were slightly less, right? It was $895 exam. That's step 3. 2023 onwards, right? This year they have increased it slightly to $915, right? And over here, eligibility extension, step 1, step 2, that was $100. This is $70. $70. By this way, you should complete whole USMLE in max 7 years. 7 years, sufficient time, right? So even if something goes wrong, doesn't matter, right? It is like you have got time. It's not end of the world. And once you complete it successfully, then rest of the life, right? That is your rest of the career, that gets a booster, right? So this is about USMLE, United States Medical Licensing Examination. Every step, every point, right? I have mentioned it over here. Preparation, I would just use one sentence. Right from the beginning. From the beginning. Right. For all these exams, right? They are called as the classical exams for medical science. Prepare right from the beginning. So once you decide that yes, want to go for MBBS, I want to do it, right? Don't waste any time, whether you are in India or you are in abroad, right? Try to understand what I'm trying to tell you. Don't waste time anywhere, right? Because there would be lots and lots of attractions कि चलो अभी मजा कर लेते हैं बाद में पढ़ेंगे. Don't fall into that trap, right? Even if someone is telling you, right, that person is your dushman. Simple. That person is your dushman. Start studying right from the beginning, right? These exams, once cleared, once you reach over there, once you start earning, you will feel like that whatever the money which you have spent for the preparation or for the education, right, you just get that entire thing back within 1 month, right? Your pay skills would be to that level. So, but give your heart and soul to studies, right? Study very properly. All right. Tomorrow morning, we are once again meeting at 11 o'clock, right? At 11 in the morning. And that's where I'll also be talking about some other exams, right? There are few exams which are for, say, PLAB, and then there is MCCEE, etc. Right? It will take just 15-20 minutes before I'll be telling you about that. If you have decided that yes, I want to go for MBBS, so then two-way things. One, from the perspective of parents, and second, from your perspective. This entire is like a mission, and everyone has to play their role. You must have seen that when those runners they are running, right? When those runners they are running into marathon, there is a support team. The best support team is that your parents, right? So, but they should know that where exactly the support is needed, right? And your job is only one: study properly, right? Study properly. Literally, like give your heart and soul, right, to the studies. You'll be happy with yourself. Okay. So I've already mentioned that there is that personal counseling WhatsApp number which is mentioned on the screen. You can contact over there. Any questions, just send across, right? All those questions will reach to me, and tomorrow morning we can cover those questions. And as such, we are meeting every Wednesday and Saturday, right, at 8 p.m. over here, 8 p.m. and on Sunday 11 a.m. Right? This is the time when we shall meet, and you can send your questions. So I'll take all of them one by one. Okay. All right. Thanks a lot. And we meet very soon. Thank you and bye bye.